I'm Dr. Rachna Pandey, Consultant Obstetrician Gynecologist and Infertility Specialist practicing at Vasundhara Healthcare, Vasundhara, Ghaziabad. Today I will be talking about contraception. Every pregnancy has to be by choice, not by chance. It is the reproductive right of every couple to have access to appropriate contraceptive methods and safe abortion practices if need arises. Contraception is the family planning. The couple has to plan the family according to their desire. There are various contraception methods like barrier methods, for example condoms, oral pills, injections, intrauterine devices like Colposcopy or intravaginal devices. Every contraceptive method has its own advantages and disadvantages. Whenever a couple comes to seek advice regarding family planning to us, we always tell them all the good and bad things about the contraceptive method and guide them and help them to choose the method which is most comfortable and beneficial for them according to their choice and their requirements. Sometimes the couples, they can come to seek help for emergency contraception. Emergency contraception means that they want to avoid pregnancy post unprotected intercourse. There are emergency methods like pills which are to be taken as early as possible or within 72 hours of the unprotected intercourse. But whenever we provide them with these methods, we always tell them that these methods are not free from any side effects. They always have serious side effects. There are chances of failure, and if repeatedly used instead of the regular contraceptive method, then they may lead to serious hormonal imbalances. So, always a regular contraceptive method is to be employed. Then, there are permanent sterilization methods also. If the couple decides that they have reached a desired family size, they can go for the permanent methods like tubectomy in the females and vasectomy in the males. But these methods are permanent as already told. So these are to be decided upon after a due diligence. The person has to understand that the reversible methods for these permanent methods is not easy and they don't have a very good success rate post surgery. And also these are surgical methods. So there are definitely complications which though may be minimal but due to surgical procedures. But sometimes the couples, while they are using contraceptive methods, they can lead to failure also, or the couple may not be using any contraceptive methods and the female gets pregnant, and then they have to have an access to safe abortion practices. When the couple comes to us for these purposes, we always examine the female thoroughly, both medically as well as obstetrically. All the due investigations are done, ultrasonography is done, and the exact size of the pregnancy is determined before giving them any option for the abortion method. After all these investigations and thorough checkup, we give them the method, whether medical, by pills or surgical, and tell them about the pros and cons of all the methods and let them decide the better method, the comfortable method, whichever suits them. But whenever we are giving them an abortion services, we always tell them that any type of method used for medical termination of pregnancy is not free from side effects. there are always complications. So the first thing should definitely be a contraceptive method, and they should always use a method for contraception and should not repeatedly go for the abortion services. So we can see that the contraception is always a process of research and development, and safer methods are always coming into being. So we should always love to interact with you to guide you regarding these newer and safer methods. Thank you.